Come in.
Hello, my name is Blessing, and I'm gonna be your student nurse this afternoon.
Okay.
Okay. So before I start anything, is it okay to make a video of this assessment and post it on YouTube as unlisted for my professor to see?
Yes.
All right. Thank you. I'm gonna go ahead and wash my hands, okay,
Okay.
and then we proceed. So I'm gonna ask you a couple of questions.
Okay.
So I'll be here so you can see me. Hi. Yeah, all right. So what's your name, please?
Victor J.
What's your date of birth?
I was born in 1979, 40 years old.
Oh, okay. 1979. Mr. Victor, you mind addressing me? Addressing you like?
That's fine.
All right. So please tell me what brings you to the clinic.
Well, for the last couple of months, I've been feeling really tired,
Okay.
really fatigued. I'm not used. That's not my character. I'm active, go.
Okay.
I get plenty of sleep, but when I wake up, I'm just tired.
Okay.
I've also noticed that I haven't been able to have a bowel movement every day.
Okay.
Normally, I used to do it every day at the same time, every time when I wake up. Now it's like every other day.
Okay.
And it's just different times of the day.
Okay. What other symptoms do you experience?
That's it, just the bowel movements.
Okay.
I also have really dry skin now,
Okay.
and both my hair and my skin is very dry.
Okay.
But I don't have any rashes or anything like that, so
Okay.
it's just dry skin.
I'm so sorry to hear that. When did this happen? When did you start noticing?
It just started happening not too long ago, maybe like two months,
2 months ago.
4 weeks, or 8 weeks, yeah.
8 weeks or 2 months. Okay, yeah, let's go with 2 months is fine. All right, so has there been any pain related to it?
No pain.
Do you strain when you have
Yeah,
to cook?
yeah, and it's normally really hard.
Do you do a lot of water?
I've been drinking a lot of water because of the dry skin and to try to help me with the bowel movements, but it
Okay.
doesn't really help.
Okay, that's fine. So do you take any medication?
I'm taking for high blood pressure. Well, I was seen here for like 6 months ago, and I'm taking HT. What's the thing called? Forget what it's called. HCTZ.
Okay, that's hydrochlorothiazide.
That's 25 milligrams a day.
Okay.
But sometimes I forget, so maybe I'll miss one time a week.
Oh.
I forget.
Okay.
I mean, I know I shouldn't forget to take my medication, but
All right. Apart from that, do you take any other medicine?
once in a while I'll have back pain,
Okay.
so I'll take 400 milligrams of ibuprofen,
Okay.
but it's only like once or twice a month.
Okay. Does it help to relieve the back
It
pain?
relieves the pain, yes, it does.
And how long have you been taking the hydrochlorothiazide, the other medicine?
For 6 months.
6 months. That's when you started.
Yeah.
Okay. Do you have any allergies?
No.
Are you exposed to anything like do you have allergies to food,
No.
environment?
No.
Okay. Do you have any past medical history?
I used to have. I was diagnosed with depression back in 2001,
Okay.
and for about a year I went through counseling and took some medication.
Okay.
That's it. I haven't
Are
seen.
you still on that medication?
No, it's back in 2001, so I haven't taken anything for a while, a long time.
Have you had any past surgery?
No real surgeries. Mm-mm.
No surgeries. Okay, so tell me about your your family history.
Well, so my dad, he's got type 2 diabetes,
Okay.
and he smokes,
Okay.
and he's got high blood pressure.
Okay. So what about mom?
She's got high cholesterol, and she's got something with the thyroid, hypothyroid.
Hypothyroidism?
Mhm.
Alright.
I have a brother also. He's got hypertension,
Okay,
and he's an alcoholic.
hypertension. What about sister?
I have two sisters. One of them has she's hyperthyroid,
Okay,
and the other one has depression.
okay.
We're all messed up.
Do you, have you ever been diagnosed with diabetes too?
No,
Okay. Do you have any, ringing in your ear?
no
Yeah.
earring.
Okay, any problem with your eyes?
No.
Okay. When was your last annual visit?
I had a wellness visit. Actually, the last time I got tested, there was nothing wrong. I had my eye exam about a year ago, and dental also about a year ago.
Okay, you had your dental, any problem?
No.
You have problem with eating, swallowing?
No.
Okay. Do you have any problem, do you have like a cold,
I get chills
chills?
nowadays. I thought it was just because I was in San Diego, but when it gets a little cooler, I get the chills.
Right. Do you have kids?
I have two kids. They live with me.
Okay.
I'm divorced.
You're divorced.
Mhm.
Thank you for that information. Do you work?
I am a real estate agent, so I work about 50 hours a week.
Wow.
Yeah. And normally
That's
Normally it's 10 to 20. I mean 20 to 30 hours on the computer,
Okay.
and then normally out showing houses and stuff like that.
Yeah.
So,
How long have you been a realtor?
I've been a realtor for. Let's see. It doesn't say, but just maybe like 5 years or more.
That's fine. Your kids, do they have any problem too?
No.
Are they all normal?
Mm-hmm.
Alright,
As far as I know.
alright. So, Mr. Victor, do you smoke?
No, I do not.
Okay. Do you drink?
I do. I drink
How often?
once or twice a month.
Okay.
And I drink 2 to 3 glasses of wine. Or 1 or 2 glasses of wine when I drink.
Okay. A month?
Mm-hmm.
Okay. Have you had any, Wellman exam during your visit?
Just the regular stuff.
Just a regular?
Mm-hmm.
Okay. Do you have any support system?
Like my family and stuff?
Okay, family, what about your, do you go to church? I mean, your religion?
Not really religious, no.
You're not religious, okay. So when do you use substance abuse?
Maybe like 1 to 3 times a year when I get with my friends, we smoke a little weed.
Oh.
Yeah. It's just for relaxation. It's not to get crazy,
Okay, for relaxation.
Yeah, for
So you just
relaxing.
smoke, you relax.
I'm not
Are you stressed at work?
Not really, no.
Okay. Tell me about your diet.
I normally eat fast food 2 to 3 times a week.
Oh. Okay.
Yeah. Otherwise, I'll eat red meat 1 to 2 times a week. I'll eat fish 1 time a week, and normally 8 glasses of water a day.
Okay. So you drink some water, 8 glasses?
But to tell you the truth, I don't eat vegetables all the time.
Okay. No veggies, that's fine. What about your sleeping habit? Tell me more about it.
I normally, when I go to bed, I go to sleep fast, and I get 7 to 8 hours of it's good sleep. I don't get interrupted, I sleep well, but I wake up tired.
Wow. So you are always fatigued, like daily.
Mm-hmm.
Okay.
Yeah. Always fatigue. I don't know why.
Have you ever discussed this with your physician?
Not really.
Okay, so this is gonna be the first time?
Yeah, that's why I came in,
Sure. Alright.
I also gained like 10 pounds. Normally,
Oh wow.
I'm average for the last 10 years, I've been the same weight. And then all of a sudden 2 months ago, I started gaining weight, like 10 pounds.
Oh, wow.
Yeah, without any real reason.
10 pounds within 2 months?
Mm-hmm.
That's a lot. Alright, so these sound like a case of thyroid problem, but I'm gonna do a physical assessment.
Okay.
Before I proceed, do you have any questions for me?
How did you realize this thyroid problem?
Based on your symptoms, you having your hair is dry, okay, it's flaky, and then you always fatigue all the time, and then another signs and symptoms of hypothyroidism, it's slow gut, so you're not going to the toilet, like you're not having a BM every day, is occasional, so those could be part of the symptoms.
Oh, okay.
Okay.
I thought I had sleep apnea.
No. Do you have any problem breathing?
No.
Do you use a CPAP?
Okay.
All right. So we're done with the physical assessment
Interview,
part?
yeah.
Okay. So the next thing I'm gonna do, because I'm gonna have to ask you some of those labs. So the next thing I'm gonna do like a head to toe assessment on you, okay? I'll look at your skin. Do you have any lesions somewhere?
No.
Bruises or redness?
No.
Okay, I've already washed my hands, okay? Let me go ahead and
You want me to sit down on the shoulders?
I know,
I had to do that on the other one earlier.
Alright, so I'm gonna go ahead and palpate your frontal sinus, alright? Just tell me if it hurt. Does it hurt right there?
No.
Okay, does it hurt?
No.
Sorry, my hands are cold. Okay. And then does it hurt?
No.
Hurt?
Mm-mm.
Alright, so let me check for your lymph node. So start here. That's the preauricular, post-auricular, okay, and occipital. So I work all the way down, okay? And then let me check here. Just checking for your lymph node, okay? And let me know if you feel any kind of tenderness. Alright. All over everything. 'Cause I already did it on her. Okay. Okay, I'm gonna take a picture of that. Okay,
Okay.
thank you. So I'm gonna use this. I'm gonna skip the ice, okay, guys? They didn't tell me I was gonna be able to do it again. So let's go ahead and then look at your, I'm gonna look at your vision, okay? I'm gonna flash this into your eyes. I'm gonna use this. I'm gonna have you follow the direction of this pen, okay? So I'm checking for your, the direction of your eye muscle.
Okay.
Sorry, the movement. So, touch my finger and then look away.
Touch your finger, then look away?
Yeah, like do this, then look away. Then, there you go. Touch your nose, sorry. Okay, that's fine. So we just completed the eye exam. So I'm gonna do the hearing test, okay?
Okay.
So you're gonna tell me, when you can hear from both ears. So I'm gonna hit this and put it on your forehead, okay?
Okay.
It's called the weather test.
I can hear it. I heard it when you hit it.
All Alright, I'm gonna do the same thing on the other here. It's called rank test, but I'm gonna put it at the back of your hair and bring this to the front.
Okay. There you go. Yeah, I can hear it. Mm-hmm. Yeah.
So your eyes stays better than your BC. Alright, let me go ahead and check your head. Turn this way for me, please. Have you had any goiter, your thyroid removed before?
No.
Okay, turn this way. Let's see. Just checking for your thyroid, okay? So I'm gonna go behind you. Check for your thyroid. Swallow for me. Oh, that moved. Right now it's kind of like so rushed. I'm gonna look into your mouth and I'm rushing. So I'm gonna ask you for your laughs, okay?
Okay.
Because of your chief complaint, so I'll tell you later what laughs to show me. Go ahead and open your mouth for me. Stick out your tongue. Okay, we're gonna pretend I'm tonsils because I'm really doing that tonsils.
Did you have tonsils?
She didn't tell me. Alright, then I'm gonna check for your circulation, okay? Okay, right now it's good. I'm just checking for your circulation, okay? This is the bronchial. That's fine. Let me go ahead and listen to your heart. This is I'm listening to your lungs over here, okay? I'm gonna come back to the front. Take a deep breath for me. Out. Okay. One more time. Out. One more time. Out. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay. Take a deep breath. Out. Take a deep breath. Out. So we're done with the cardiovascular. I'm gonna be checking for your reflexes. So that one,
Right here?
yeah, you can. So I look at you, let me go ahead and feel your femoral pulses. I see a slight edema, so your pulse are good. Okay, see. Good circulation on your toenail. Okay. Thank you very much. Go ahead and take a picture of that. Oh no. I'm gonna have to. I'm sorry, I need space on my phone. I need to delete so many stuff. Let me see if I can create a space. Okay. There you go. Okay. So I check your fetal pulses, okay? I noticed a mild edema. I did, okay? So the next thing I'm gonna do is let me go ahead and take a look at your nails. Just make sure there is good circulation. Turns pink, all right?
What is edema?
It's a swelling on the feet.
Oh, okay.
Yeah. All right, yeah, so when people are building fluid, just go straight.
Oh, okay.
All right, so we're gonna be doing like reflexes. So basically, when I hit this, leg is supposed to like kind of
Right.
little flake. All right. Try not to hit my patient too hard. Okay. So I'm gonna do the patella reflex. Yeah, like that move. Alright, that. Right. I'm gonna do the same thing here. Alright. I think you should have the reflex results.
Yeah.
Thank you.
Yes.
Okay, good. Thank you so much.
Thank you.
Let me make sure I get everything. Let's see. Sure. Okay, so I've checked your heart, your respiratory, and I've taken a look at your neck. So so we're done with the physical because this is a focus exam.
Okay.
Except you have any other complaint?
No.
Okay, so based on my findings and what you told me, you probably have what is called hypothyroidism.
Okay.
Okay, so I'm gonna refer you to endocrinologist. Okay, for that evaluation.
Okay. What is
But so they're gonna check for your thyroid level. Can I see that? So I'm gonna send you also to the lab for a CBC,
to the lab for the CBC?
CMP, and thyroid level.
CBC.
Okay.
And what's the other one you said?
Let me have okay, so that's CBC, CMP, yeah, CMP. Okay. Let me also have one for your A1C, diabetic, just to kind of rule things out. Okay. Already have this. I'm gonna scan that out. So like I said, I'm suspecting thyroid, and I also wanna see your thyroid level.
So you're suspecting I have hyperthyroidism?
Yes, so your TSH level is what will kind of give me an idea, okay? So do you have that too?
TSH level.
Uh-huh.
Yes, I do.
Okay. Okay. Let me open this since I didn't get a chance to do this one. Okay, so I'm right. So you do have elevated TSH.
Okay.
Okay. So what I'm gonna do, it looks like your blood pressure medication, it's Do you take your blood pressure before taking your medication?
I don't check it.
Okay, so yeah, you need education on that. You do wanna always check your blood pressure
Okay.
before taking it. Okay, check it when you're laying down. Sometimes, most time, we always recommend like when the patient is laying down, they check it. When they are sitting, they check it. Standing, to kind of rule any kind of hypertension that could lead to dizziness. Okay,
Okay.
orthostatic hypertension, and also eat fiber. Okay, it helps also to relieve constipation,
Mhm.
and also for the ibuprofen, which you do take for back pain, since it's PRN, continue to do that.
Okay.
But the main thing is that check your blood pressure. Don't take it.
Don't just take my pills
Don't
without
just-
checking.
And also never stop taking your blood pressure medicine.
I forget once in a while.
You always have to, because you do not want to you don't want to be at risk for stroke.
Oh, okay.
Yes, because most patients, middle-aged adult, they always don't, sometimes, nobody want to do that, but you have to protect yourself. It's all for safety.
Okay.
Okay, so I'm gonna send you to endocrinologist for further evaluation, all right?
Okay.
And then return back to the clinic, as soon as I get the result, we'll call you
Okay.
and make an appointment.
Sounds good.
All right, do you have any question for me?
No.
All right, thank you so
Thank
much,
you.
Mr. Victor, it was nice working with you.
Thank you.